Hey, y'all, welcome to the Unleashed Performance Therapy Podcast. I'm here with my co-host, Robert McNair. Very excited to introduce our guest on the show today, Dr. Ciara Burgi. Dr. Burgi, how are you doing this afternoon?
I'm doing great. How are you guys?
We're doing great. I am at least
Good.
up here in North Texas. I don't know how they're doing in Houston. Robert, how's it
It's
going over there?
it's actually kind of chilly outside. It's 68 degrees, so we're
Oh,
pulling
wow.
out the winter coats again.
It
Odd temperature
is
change.
currently 43 degrees right now here.
No thanks. No thanks.
Yeah, so I'm really excited to talk to Dr. Burgi. I kind of follow her along on her LinkedIn. I missed a seminar she had with our school, University of St. Augustine, so I wanted to get her on to kind of talk about what she does. So, Dr. Burgi, do you want to give us a little bit of a rundown on who you are, what you do, who you currently work with, and who did you work with in the past?
Yeah, for sure. So I guess career journey, just going through that. I thought I was initially going to be interested in strength and conditioning and did that after undergrad for a couple of years. And then decided that I wanted to go to physical therapy school because I would get athletes. I worked at a outpatient clinic that had a performance program associated with it. And I would get athletes after they ran out of their visits from an ACL or whatever and just wonder what happened at the front end of that process, and kind of got curious about the front end of that process. And so that kind of drove me towards taking prereqs and going to physical therapy school. So I went to PT school at Duke in North Carolina. And then after that, I did a sports residency at Houston Methodist Sugarland in Houston, Texas, and then stayed there for a couple years afterward. I just was on faculty, did a manual therapy fellowship, and just got a lot of repetitions in an outpatient ortho sports setting. And I'm so grateful for that time there. And really good mentorship to start my career. And then I just got a little bit curious about what higher level athletics was like. It wasn't like my dream to work in higher level athletics. I was just curious what it was like. So I knew that Duke had a Division I athletics fellowship. So I applied to it just frankly to go hopefully get an interview so I could see what the environment's like. And so luckily I got an interview and loved it there. Thought it would be a great fit. Loved the environment, loved the culture of Division I athletics. And so they offered me a position to do the fellowship there. So I was there for a year. And then after that year was over, they offered me a position to stay on staff there at Duke. So I was at Duke for 3.5 years total. I got to work with all the different sports that are at Duke and got to dip my toe in some sports science stuff as those initiatives were getting started there in that time in the world. And then worked in strength and conditioning a bit as well. So I got to have a pretty diverse role that kind of spanned a lot of different disciplines. And then towards the end of my time there, the Houston Texans reached out to me and asked if I'd be interested in a position there. Just through a mutual connection, they reached out to me. And I frankly wasn't all that interested in it, but I thought I would go interview because I might as well.
Just check it out.
Yeah, exactly. And so I went and interviewed and kind of decided that was the next step for me, even though I love Duke and would have stayed there forever. I was having a great time there. And so I was at the Houston Texans for about 3.5 years, or a little over 3 years, I guess. And then this past February left there and then started about 3 weeks ago with the Las Vegas Aces, the WNBA team here in Vegas. And I am the director of health and performance here. So smaller roster, but overseeing a staff and in a leadership role for the first time, or a formal leadership role for the first time. And so we have one PT on staff, one AT/PT on staff, and then a strength and conditioning coach and myself. So there's 4 of us kind of on the performance team here at the Aces. And yeah, we're about to get rolling in about a week here with training camp. So it's happening, but it's good.
That's awesome. And you're moving, you're kind of rocking and rolling. It's like you said, you're having to get a lot of reps in, and throughout your career, it seems like you've had a lot of different experiences, a lot of repetition. At Duke, you said you worked with all sports. What do you feel like was the most exciting sport that you worked with at Duke?
Man, that's a tough question. I think I learned to appreciate all of them because I got the experience to spend time with all of them. I think I was grew the largest appreciation for wrestling. I liked the guys a lot, but their practices are miserable, more miserable than any other practice I've been around. So just got a ton of respect for them and their work ethic, and was probably most surprised by that, right? I sort of knew what football was going to be like.
Yeah.
I expected what basketball was going to be like. lacrosse, like I expected what that was going to be like, but wrestling, I was just like, oh wow, they're like literally in a dark room in the basement just grinding it out like you would picture. And like I got a lot of respect for them. So I loved all the different sports for different reasons, but I would just say like mad respect to people that are wrestlers, because that is tough, like really, really tough, like strength wise, metabolically, mentally. It's there's a lot involved, and I really grew an appreciation for it that I didn't have before.
I don't think we ever think about wrestling when we think about sports. You know, we always
Right.
the big three: basketball, football,
Yeah.
baseball.
Yeah.
As far as collegiate sports, so what was when you hit that turning point between Duke working for D1 collegiate sports and you went to Houston Texans working with a professional level? How was that transition for you?
Yeah, I mean, I think from like an athlete perspective, it was great. I think as an outsider, at least speaking for myself, like what you expect when you get into pro sports is what you like see on TV. And I thought it was going to be like a bunch of hyper masculine guys and whatever. It was just going to be that kind of environment. And, you know, I thought they would be cocky and whatever. And like, honestly, it is the nicest group of men that I've ever been around. Like a really, really kind, great, like just great men, like really, really good people, great family men, really care deeply about each other. And like, they're very like gentle for how aggressive of a sport they play. Like on the day to day, they're like very gentle, and their personalities are so diverse. Like some are really nerdy artists, and some are filmmakers, and some are, you know, like they have like so many vast interests. And so like I
Wow.
really, it was like such a pleasant surprise to get to know them as men, and like it was such a cool group of people. And the other thing that I like about pro sports is you get more like diversity in life stage. College is fun, don't get me wrong, because they're in a very transformational time in life, right? They're leaving their parents, they're figuring out what the real world is like, and it's cool to be part of their life. But it's all like very similar life stages where like you have a 22-year-old and you have a 36-year-old. And so like there's just like different people with different life experiences. And so like the diversity in life stage is really, really cool about professional sports. And so like the athlete transition it was easy. I think like they're just really, really good men. And I was super surprised by that, again, because of what we see and hear in the media and perceive that they are. And then, yeah, it was a tough transition just because I would say on the other side of things, like coworker politics of professional sport, I just didn't know what that was like, and was very unprepared for that, I would say. And so like from an athlete transition, from a physical therapy transition, it was fine. But that's not the most challenging part about working in a professional environment. And so I was like pretty unprepared for the, I don't know, that
The
transition
extracurricular
from,
stuff.
yeah, the transition outside of the direct day-to-day care. And you think about it, like there's a lot of people who are some of the best at what they do in the world all in one building. And so that's going to result in some tough conversations and a lot of differing opinions. And sometimes it's tougher to get on the same page when you have an entire group of people that are phenomenal at what they do. So it was just, yeah, it was a transition from like that side of things. But I can't speak highly enough about like the guys themselves and the environment there and the coaching staff. Like, yeah,
That's very
exceeded
interesting to
expectations.
hear. That's very interesting to hear. We spoke with a head athletic trainer for the Utah Jazz a few weeks ago, and one of his big things is he said that football was too hot. That's why he liked basketball more.
That's fair.
He didn't like to be out in the heat.
That is fair, especially in Houston, Texas. Like your
Oh, yeah.
wet bulb globe temperature is like 120, and you're like,
Yeah.
this shouldn't be legal, but we're doing
Again.
it in full pads. And
You look out the window, you start sweating. That's
no doubt it
that's
is.
Houston.
It is
sure.
toasty there, no
So
question.
you're still in the professional realm, and it was funny because a lot of times when people go into physical therapy, of course, that ultimate goal is I want to work with a professional team kind of thing. But you were saying earlier that really necessarily wasn't your goal. Was it initially just being with almost any athlete, like sports medicine or just ortho? What was your
Um,
initial?
I think like what I care about what I do is like the relationship piece of that, and like the ability to like be a part of someone's journey when they're going through a tough part of their journey, and like connecting with them and having deep relationship with somebody. That's why I'm a better fit for like physical therapy than a physician, because they have lots of relationships but they're short, right? And I like
Right.
value depth of relationship. And so I think that physical therapy is a good way to establish depth of relationship and be with someone along a journey, whether you like them or not, you're with them for a while. And so like that's what I really value about what I do, is like being able to deeply care for somebody and like establish depth of relationship with them. And I can do that in an outpatient clinic. I can do that in professional sport. I can do that in a hospital. Theoretically, like that's not a good fit for me, but like what I care about what I do, I can really do anywhere. So it's just a matter of where the geographic location is. Like population doesn't matter to me. Again, like I'm a good fit for pro sports at this time in my career, but I don't value the level. I more so like value the opportunity for a relationship.
I like
That's
that. I
very
think
common.
I'm in the same boat as you with that. I've been a tech for forever, and of course, I'm thinking, okay, I really want to go do these professional sports. So, when I got my tech job, me helping this little 70-year-old lady with frozen shoulder, it
Yeah.
actually, like the reward for me was more than me like returning to sports with somebody. So, I definitely could see that.
Yeah, some of my favorite people to this day are like from my outpatient time. Like I still think about this like 95-year-old guy that was like awesome, right? And like he's still probably in my top 10 favorite people I've ever worked with. So it's just like, yeah, we just connected super well, and like that's
Right.
what really matters to me. So like that can happen anywhere. And like all types of people exist everywhere, right? Like people always perceive like, oh, I want to work with professional athletes because I want to work with people that work hard. It's like there
Mm-hmm.
are people that don't work hard everywhere. There are people that work hard everywhere, right? There are people that
Right.
I don't like that much. So, like there's all types of people exist everywhere. So like, yeah, it's not a valid reason.
Yeah, it's very hard for me to work with someone who doesn't want it. Like they don't
Yeah,
want to. It's
Mm-mm.
no
really
doubt.
hard for me to, because I don't feel like, um, I don't really feel like it's my job to motivate somebody,
Yeah.
right? I feel like I'm going to provide them with the tools, the suggestions, and they can make the decision whether they want to
Mm-hmm.
do it or not. And I think
Mm-hmm.
that holds true for at any level of injury or injury prevention.
No doubt.
Um,
Yeah.
we kind
Accountability
of
is a big part of care.
we kind of glossed through your career. Well, you said you started out an outpatient, you went to Duke, and you went to the Houston Texans. Now you're with the WNBA. So where do you feel like was the pivotal moment in your career where something just clicked, something changed, and you were on your way up into this working with professional sports?
Oh no, things froze for a minute. I'm sorry.
Oh no, you're good. You're good.
Okay. That's why I was
I
pausing.
was asking. You're good. I was asking, what do you feel like was the most pivotal moment of your career where something changed, something happened at some point in your career where you
Yeah.
went from working here and then all of a sudden things just started to fall into place and you went to collegiate sports and you went to the professional
Mm-hmm.
realm. And, where did that happen?
Yeah, I think like whenever we're starting anything new, we're trying to figure out like if we belong or not, right? And so I think like there's always this amount of fear whenever you start any new job or anything. It's like, dang, am I good enough for this? Like if you for sure know you're quote unquote good enough for something and you're going to crush it, like maybe it's not the right opportunity, right? Like we should always be a little bit scared about the next thing. I think that that's healthy. And so I think like yeah, when I first went to Duke, I was like, dang, am I like good enough to work in college athletics? I don't know. And so I remember an athlete got injured there and I took over her care, or I took her care from the very beginning. Like I took her to the x-ray appointment the night that she got hurt, right? Like we started our relationship from the very beginning, and like somewhere in the middle of working with her and her doing great and responding well to me, and we got along really well, and like I was like, oh, like I do belong here, I can do this, right? And so I think that you like every time you start something new, you're looking for like belonging cues, and if you do belong in that environment. And so I think like each place that I started new, I remember like a particular person that I worked with where I was like, okay, I do belong here. And so I can think of like an athlete at every stop that was like my first confirming belonging cue. And so that girl is like mine at Duke for sure.
Cool. Do you feel like that was part of the reason that you initially weren't interested in going to work with the Texans? Like, did you feel like maybe I can't do a professional team, or was it just something else completely?
No, I just loved my job at Duke and like got to write my own job description and had a great friend community there and loved North Carolina geographically and was having a blast and got to build systems and processes and loved my boss. And I was like, I was
Do I
so
want to
happy.
leave this? Yeah.
I had no intention of leaving because I don't care that much about this. Like I don't care anything about the status of working in professional sports. So it's like the grass is so green where I'm at. Like, why would I leave? Right. And so it took a long time and a lot of convincing and some stipulations for me to leave just because I was so happy where I was at. So it wasn't like self-doubt. It was just like, I'm in love with where I currently am. So why would I leave? Yeah.
Switching gears a little bit, I'm kind of wanted to talk about specific things that you did throughout your career. Working with Duke, you worked with all kinds of different sports. So you're seeing all kinds of different injuries, different mechanisms of injury. And then you go to professional sports and you kind of see these higher level injuries, if not just more severe. What do you feel like is the importance of injury prevention? Did you use a lot of different approaches at Duke and then kind of carry that on towards the Texans, or did you kind of just learn as you went along?
Yeah, I think like anytime. Okay. Sorry. Anytime you approach a new environment, you have to kind of take a 30,000 foot view, step back, and just kind of look at what are the needs of this environment, right? Like, what do we need to be successful here? And maybe if there is a historical long string of injuries, you want to focus in on that. Like, it just really, I don't mean to give a vague answer, but it completely depends on the environment. Like, we always want to show what we know. And that's not necessarily always the first priority when I come into an environment here. Like, thinking about my current job here at the Aces, right? Like, could I implement a movement screen and then exercises based on a movement screen of deficits that I see for common injuries that I know that they have on their team? Like, I absolutely could do that. But what's the biggest priority here right now? It's really to make sure that we have all new medical staff. So it's to make sure that the girls build up trust with us and feel really cared for in our environment and want to spend time in our environment and value what we're doing and feel deeply cared for. Like, that's not a injury prevention program where I'm showing you what I know and doing assessments, but that's the biggest priority here right now, is to like build a foundation of trust and, you know, make the athletes be excited to be here. And so that's how we're preventing injury this year, is just by building trust and building trust in the medical staff and getting girls to spend time with us, right? And so it doesn't have to come in the form of an assessment and then an intervention. It can. And next year, once we have that foundation of relationship, it'll be there. But you always have to take a step back and like try to understand what the priority is of the environment, not what your priority is, right? Because if you know a lot about injury prevention and assessment, you're going to be excited to go in and show what you know. But like that, what you know is maybe not what the environment needs. You need to figure out what the environment needs and how what you know filters into that. So again, not to give like a vague answer, but I just think it depends on the environment and like what the needs are of that environment and like where you best fit.
Well, when you showed up in Houston, did they have anything in place as far as all the athletes? Was there something that they did specifically so they could prevent
they had like a
common
movement screen that they
injuries
would
or
take
anything like
athletes
that?
through.
Do they have anything in place?
I think in football, it's a lot about like proper equipment and proper shoes and proper padding and making good decisions there. It's about proper technique. It's about making sure that the coaches understand the best way to plan practice from a high-speed running standpoint, right? And so it's like, again, what are the big picture? What are the injuries that are commonly happening? Hand fractures. All right, what am I going to do about that, right? And so like that's like an equipment oriented thing, right? Or a stylistic thing of how they're punching the ball out or how they're tackling, right?
Yeah.
If you have a lot of hamstring injuries, all right, what are the precipitating factors of that? Like, sure, we can look at the smaller pieces of hip range of motion and anterior pelvic tilt and NordBoard strength, and all of that stuff is important. And if you're blowing them out with high speed running on Wednesday and Thursday and Friday, and then they go play again on Sunday, like you probably can't anterior pelvic tilt your way out of that, or posterior pelvic, right? Like you can't. So you just have to like understand all of the factors involved, and then what are the lowest hanging fruit. And more often than not, the lowest hanging fruit are education or equipment or environmental changes or sleep or hydration or nutrition, right? It's, yes, I'm not saying those biomechanical things don't matter and strength doesn't matter. It absolutely does. And what are all of the other factors that are outside of the world that you're most comfortable inhabiting, which is biomechanics and strength and mobility, right?
Yeah, like Jamie said earlier about motivating people. Now you're on this professional level, and again, it's their profession. So you would think, okay, they have this drive, this initiative. You don't have to really push them. Did you see a big change from going from collegiate to professional? Because I know you have some collegiate students that they're definitely trying to go to that next level, but then you have others, they enjoy that sport and they're not planning on doing anything beyond that. Do you feel that it was a big change when you got to professional level with the Texans and the Aces, as far as, hey, this is what I'm selling
From
you,
like a
you need to
professional
buy it
standpoint,
and
I
all
think
that, or
like
they just kind of
guys
went
are
along
more
with it?
likely to have their own people and their own providers that they see outside of the building and that they trust. Not more likely, but they are likely to have that. And so you just have to figure out how to work with other providers and things like that and get them to buy into what you're doing as well, right? And so it's all about like being open to the other people that they are seeing outside of the building, but really trying to educate them on what you want to do and how you want to help them. I would say there's more skepticism in professional sports from the athletes, because they are ultimately protecting their careers and protecting their bodies and protecting their dreams, and they feel like they have to look out for themselves a little bit more than in college. It's probably a little bit more easy trust. But if you get good results and you educate them just like we educate our 78-year-old grandma, right? Like they still need education, they still need buy-in, they still need all of those things at that level as well. And so if you get good results, they're gonna they're gonna want to spend time with you. If you're like shady or unsure about your answers, like they'll sniff that out real quick. And so I just think you have to like, again, prioritize relationship, prioritize like curiosity and trying to understand where they're coming from. And then offering, like, you just have to take time to build trust and not assert yourself too hard. Because I would say in college athletics, you can kind of assert yourself a little bit harder because their circle of people who are caring for them is a little bit smaller. And so they're going to be more likely to trust you in that environment, which makes sense. Like, it's not their livelihood and their career and all of that necessarily in the college environment. And here it's like literally their dreams and generational wealth.
Yep.
And so they're going to rightfully so vet people out a little bit more.
I didn't know that you had worked with all the different sports there at Duke, so you kind of have a unique opportunity to talk with you about more of these collegiate sports. So working in the collegiate sports with the track and field, those long distance runners, what kind of things did you put in place, or did you have to put in place for people who are having chronic injuries from running? Because I know that's a very, very common thing. As a runner myself, I tend to have a lot of knee pain, ankle pain, that kind of thing.
I think it depended
I treat
a
it the
little
way
bit,
that I
but
can
I worked
by
with cross
myself.
country pretty closely.
What kind of things do you put in place for your college
a lot of their injuries are like volume based. And so if you have a little bit of dysfunction and then you put volume on top of dysfunction, it's going to generally create a problem. So yes, it's partially trying to figure out what the dysfunction piece is, but then also figuring out the larger factors of what's the coach's openness to controlling volume. Like, is a 10-mile run really a flush out run? Like, is that or not? You know what I mean? So it's like trying to understand where the coaches are coming from and what their philosophies are, and then trying to understand where you can make changes, right? Like, yes, I can improve someone's ankle dorsiflexion or strength a little bit, but at the same time, like, volume is volume. And if they're unprepared for volume for other factors, then that was tough. It was tough to get coaches to buy in, even to strength training and stuff like that. Again, because the perception is, well, we don't want them to get big and bulky and then that won't be efficient for running. And it's like, right, that's not what happens. And that's not the benefit of strength training, right? Like, So it's like the battling culture. First of all, understanding culture, and then figuring out how you can influence culture. Like, because you don't want to come in and assert yourself too hard with the coaches, but it's really like trying to understand their culture and their steadfast beliefs, and then matching that up with science, which it doesn't always match up with, and then figuring out where you can make change. Again, like for the female runners, I think like a lot of them were under fueling. And so again, what are the perceptions that surround fueling? If you don't have enough fuel in your gas tank, things are going to break down. So like maybe it's not an ankle dorsiflexion problem. Maybe it's a you need to eat 3 large meals problem. And so like, again, it's like taking a step back, understanding all the precipitating factors, and then figuring out how you can influence those. And I think like meals, understanding that it's not normal for them to not get their period, right? And like talking about that and getting that out on the table, trying to influence volume, right? Like none of those things are theoretically biomechanics or strength or mobility. And I'm not saying those things aren't important, but like those were our biggest rocks that we tried to move, was trying to influence sport culture, and how people progressed back from injury, or what are the signs of a stress reaction so it doesn't turn to a stress fracture, and what do we do when we start to sniff a stress reaction, and how do we modify that? And so it's just like a lot of understanding surrounding culture, and then education and trying to influence culture.
How do you feel like that relationship was between the rehab team versus the strength training team versus the coaching? Was it all pretty meshed well together, or was there any pushback from the strength and conditioning side versus the rehab side? I just feel like sometimes in our profession that PTs won't necessarily refer out to a PT, a personal trainer, or a strength and conditioning coach, and vice versa. The strength and conditioning coach is kind of worried to send their person to a PT because they don't technically know how to do the things that they know how to do. Which comes back to a big point. Some people say that all PTs should work out. All PTs should know how to do all kinds of different movements, versus it's like squats, deadlifts, all the basic stuff. And I think that some strength and conditioning coaches don't feel like PTs have the
it's
correct
all
knowledge
fair,
to
right? Like there are
take their
horrible
athlete
physical
to
therapists
the
and there
next
are
level.
horrible strength coaches, right? So let's not get too caught up in like profession versus profession and past experience versus past experience, right? Like here's a great example. At Duke, there's some athletes, if a strength coach worked with that team, that I would trust myself to take them a little bit further along the rehab process. But then I also have to know when to get out of the way. So there are certain strength coaches that I thought were really, really good. And like, I have to have the humility to step back and be like, oh no, you're better than me at this stage. And I don't need to be the primary care provider at this point. Right. So I think that like, we always need to, we have no problem telling other people when they're not appropriate to help out, but like how often do we say to ourselves like, okay, I'm no longer the best person to continue this person's care. And like that was big for me when I was at the Texans. Like I didn't know how much I didn't know about speed and power development until I met my coworker Joe there, and I'm like, oh, I have no business doing long-term rehab, like end stage long-term rehab. Like you have all the business doing that. I have no business doing this. And I used to think that I did, but like once I met Joe, I was like, okay, this was a huge blind spot I didn't know I had. Right. And so I think like you got to know when to get out of the way. And when you work in higher level athletics, there's more likely to be people that you should allow to get in your way, because there's going to be people that are going to be better at that stage. So we have to know when to get out of the way. And few people do that.
Yeah, that's great advice, and I'm definitely gonna have to take that for myself, because I'm gonna have to learn how to, just like you said, have that humility, learn the
can I coach a
humility,
squat in the
and
weight room?
know
Like
when
absolutely,
to
and
step
I
aside
can periodize
and let
that in
someone
the
else
science
take
sets and
over.
reps
I'm
and
really gonna have to
percentages
learn
of
how
one
to
RM,
do
right?
that.
But like my coworker Joe's been coaching that for 15 years. Like he's probably better than me, even though I can do it. Is he better? Yes. Yeah, 1,000%. Yeah. So yeah, I think that's really important, and I don't think we do it
They
well.
just
And
see
that's where
things a little
turf
bit
battles come
differently,
in.
and they can dissect it more. Was there anything specific that you do for those athletes in all the different levels that
Yeah, I mean, I
is
think
it
it's really
it can
like,
probably
and I'll
differ
like
too
credit Sue
to
Falsoni,
assess
who
them for
was
their
a
readiness to
legend and was
return
my
back to
boss
their
at the
sports?
Texans for my last 2 years there. But like the concept of reverse engineering, and so understanding like, all right, what are the qualities of athleticism that we value? Maybe like acceleration or some sort of linear speed, right? Acceleration to max velocity, and then some kind of deceleration. We value change of direction. We value strength. We value power. We value some kind of energy system development. We value sports specific skills, right? And so, like, what's the end stage of that? And then how are we reverse engineering our way from the end to the beginning? And so, again, like, think about it. Football, I think, is a great example because there's so many different body types and sports within that one sport, right? So, like, you don't need to get a big, like a left tackle back to max velocity, but you better get your gunner back to max velocity, right? And so it's like understanding what the end point is for those people, and reverse engineering your way back to that. I think if you have testing norms like baseline norms for that
Okay.
athlete available, like it would be nice to know, are you back to your performance baseline, right? If you don't have that, then you can look at position norms or sport norms or something like that. But right, like when I'm returning you, are you at least who you were before, and or are you in the ballpark of who you should be relative to your position group, relative to your sport? So there's a lot of resources of normative values that exist, and I think we clear people and get them symmetrical or whatever, which is fine. I'm not saying that's not important. It is, but like you can ride a bike can have two flat tires and they're symmetrical. That doesn't mean you're going to go ride that on a 10-mile ride. And so, right, like take it one step further. Yes, past your quote unquote symmetry norms and those things that you care about, but like, are we really setting up people for success when it comes to performing? And that I think comes with having some sort of baseline understanding of what you're getting back to from a capacity standpoint, from an intensity standpoint, and then thinking about the skills that you value, the qualities of athleticism that you value, and reverse engineering your way from the end back to the beginning. And so that's how I generally will think about like rehab progressions and getting someone to the end.
Yeah, I'm glad you said that because I'm not a big fan of the standardized testing as far as like things like the single leg hop test and stuff like that. Like you said, they're important. It's good to make things symmetrical, but I think that looking at the individual as an individual will
Yeah,
make
I think
more of
that
a
that is a
difference than
valuable
seeing if
part
they
of the
can
process,
do a
and
single
it's
leg
not the
hop
end all
test
be all.
the same on the left, the same on the
One
right.
singular factor that's going to tell you that someone's ready to roll.
Are there currently anything that any emerging
I
trends
think
or
it's
developments in the
really
sports rehab world that
important
you're
that
excited
like
to see come to fruition?
neurocognitive things. Dustin Grooms's work is making its way onto the scene. I think so much we've historically focused on biomechanics and mobility and strength, and all of those things are important. And also, the brain controls everything that we do. And so, it's kind of this really confusing system that we don't necessarily know how to impact, and we don't know how to it's not like lift more weights and you will get stronger. Like, that's pretty straightforward of how you get from point A to point B, right? But like, how do we start to dissect the very complex neurocognitive connection and incorporate that as part of our rehab, not to replace it and go off the deep end and only do that stuff, right? Like all the basics still matter, but decision making, right? Like name a sport that doesn't have decision making, name a sport that doesn't have some kind of cognitive element. And so rehab traditionally, it has an absence of decision making and cognition, and has a very controlled environment with perfect mechanics, and we coach perfect biomechanics, and then we get out on the court or on the field, and there's things to see and decisions to make and things to anticipate, and like that's really where things break down. And so I think that like it's exciting that more of that stuff is coming onto the scene and starting to have some like digestible ways that are you can implement that into your training, into your rehab, into your testing, because I think it's just like traditionally hasn't been something that we have considered, because it's confusing and it's tough to dissect and it's multi-layered, and you can't tangibly see the results like a bigger muscle, right? And so I think like the continued growth and understanding of that, I think is going to be a massive game changer.
Is there anything specific that you can think of, any technique or
Yeah, I mean, I think it's
or
just like
intervention that you can think of
so many
that
things.
has
Like
to do with
cueing is
that
an example
you
of that,
can
right?
implement
Like
now?
internal cues versus external cues, having people do cognitive tasks while they're doing or visual tasks while they're doing something as simple as mini bands, right? Like involving cognitive decision making, or having people move based on an auditory cue if their sport involves that, right? And so like starting to have other stimuli, taking vision out of the equation, right? Like I used to always be like, all right, make a quad set, like do a quad set and look at your quad to have it contract, right? And like now they're finding that like, okay, that's fine, but you're building an over reliance on vision to contract the quad. And then you're using that, and that's not a pattern that you want when you're out on the field playing soccer, right? So you're building poor neuroplastic pathways all the way when you start on the table day one post-op. And so it's like understanding how you can build better neuroplastic pathways from the very beginning. And so it's like starting to involve that stuff from the very beginning. And sure, yeah, you'll use it more at end stage. You can use some decision
These are
making
things
there,
that we
but
see
like
a
the
lot
early
in speed
stages
and
of rehab
agility
are so
currently.
closed and so controlled and so lacking of anything cognitive whatsoever. And like that's not building good neuroplastic pathways for an uncontrolled environment that's full of decision making and vision and anticipation and perception, right? And so it's just like, yeah, we've been like historically building really bad neuroplastic pathways because we didn't know any better, right? But when you know better, you do better. And I think that there's a lot of things out there that are showing us how to like know better and do better, that I think we need to listen to and start to implement.
Was it a big transition, or you call it a
Yeah,
transition,
12.
going from the
Once we're in
Texans where you
season,
have
probably,
this
yeah.
53-man roster, now you're with the Aces, maybe 12, 15 people. Yeah. Because I'm sure with that many people, you definitely have like a team. I'm not sure exactly what your I say your title at the Aces is, but do you find it a little more
Yeah, I think
what's it, calming or
it's
easing that you
definitely the
have
expectations
just a
are
smaller group of
different
people that you're working
in
with?
like a smaller rostered setting. And I would say the expectation for like depth of care and to know everything about those 12 humans is a lot higher. Like I can't know everyone's baseline, what their talocrural joint feels like on a 75-man roster, right? Like it's just not possible for that to be. But like that's the expectation here, is that we just have like a really good understanding of everyone's body map and where they're at, right? And so it's just like the smaller roster is going to bring the expectation for more depth, more of a concierge experience, right? More individualization rather than, all right, bigs, mids, and skills each have your own lift. That's it, right? Like this is like the expectation is an individualized lift, an individualized program, because of the smaller roster size. So it's like, it's not better or worse. It's just different in like the expectations are different in this type of setting. And so that's just like a transition for me to, yeah, like less people, but like more to worry about that one person or more to be accountable for. So it's a good transition because I haven't worked in that small of a roster before.
Well, Dr. Burgi, before we let you go, I've got to ask the question. I'm sure you get it all the time. As student physical therapists, what are some things that we can do? What's the best thing for us to do for those that are aspiring to work in sports, aspiring to work in professional sports, collegiate sports, is getting to a higher level of treatment with those
Yeah,
with
I
that
think it's
population?
tough,
What are
like in
some things
general,
that
to
we
get
can
your
do as
foot in the door
students
in higher level
to kind
athletics.
of get
And
our
like
foot in
I
the
do
door with that?
understand why, right? Because ultimately it's our job as a staff to protect the athletes and protect how much information gets out about them, right? And I won't trust just any random person off the street who's interested in sports physical therapy to come in and not spill the beans to someone else and just tell their buddy about it, which goes to someone else, which goes to someone else, right? So like I understand why the closed system exists, and it exists for a purpose, and it's to protect the athletes. So I think like the best thing you can do is just reach out to people who work in jobs that you perceive you might want to have and try to have a better understanding of what their world is like. If they don't get back to you, like, it's okay. It's not personal, right? Just like shoot another jump shot and try to reach out to someone else. It's not that big of a deal. It's not rejection. They're just not engaging back. But I think like as much as you can, try to understand the environment that you perceive you want to be in, and don't just ask questions to confirm that it's the right decision for you, right? Like, oh, do you get to be on the sideline? Like, oh, do you get free meals? Oh, are the guys really cool, right? Like, yes, yes, and yes, right? But like, what are the parts about our jobs that are really tough? What are the parts that
Right.
wear on you, right? The free meals, the free clothes, and standing on the sideline is a very transient thing that goes away quickly. And so like, what is it about the environment that you perceive you want to work in, and like find out all that you can about that, and like, do you really still want that? And it's okay if you don't, but it's not a challenge free environment by any means. And so like, find somebody who will be really honest with you about their experience, because there's many layers to everything, and try to understand the crappy parts of everyone's job, and if you think that you can deal with that, rather than just like perceiving that you want to be somewhere because of status and money and whatever, right? Like, you'll be miserable.
Someone once told me, if you're looking at working in a job, some people will say, like, where do you see yourself in 5 years? And someone has told me to look at it in a different way, kind of look at it in a kind of
I like
flipped
that.
way, where if you were to leave this job in 5 years, what would be the reason why? And that kind of,
Right.
and that kind of
No, I
shows
like
you like
that.
what
Yeah,
you
I
really
hate the like,
hold
where do you see
important
yourself in
to
5 years
you
question? Because like,
for in
who
the work
knows,
setting.
right? Like, how different of a person are you now than you were 5 years ago? Probably pretty different, right? So like, you want different things for yourself
Exactly.
now than you did for yourself 5 years ago. So like, don't be on too
Exactly.
closed down of a one-track mind, and like, be open to whatever comes up, whatever that may be. I think that that's super
Absolutely.
important. Yeah, I would agree. Question.
All right, one last question. Describe what you do in 3
No, it's
words.
good. It's good.
Always got to throw them off.
Little curveball.
I would say love, curiosity, and connection. There you go. I don't know if I'd wear it, but I would say that's probably
Love,
what I would say.
curiosity, connection.
Yeah.
That can be a T-shirt.
That's
I
a
know.
good-
Yeah,
there you
it's
go.
not that though.
That's a good.
That's
three.
one of those
That's a good
live,
three.
Yeah,
laugh,
I think
love
it like always
type of
comes back
things.
to like relationship for me, and I think that that's like the foundation of getting good outcomes.
All right.
And so like, that's what it comes down to for me, and like why I do what I do. So that's probably why I would choose that.
100%. 100%. That's I've always told people that you can be the one that knows the most.
Yep.
You know all this stuff, but if you
Right.
can't
And
hold
I've
a conversation
I've
with
worked with those
someone
people
without
before.
them
It's
thinking
like,
that you're an
they're not.
asshole,
You might know a lot, but like,
then
you're not going to get good
nobody's
buy-in.
gonna
And so
like
if you
her.
don't get good buy-in, like,
Yeah,
you're
you-
not going to get good outcomes. And so like, there's even studies like, right, doctors that have great bedside manner but make more surgical errors get better
Exactly.
like patient scores than people that are great surgeons but have horrible bedside manner, right? Like, yeah, that's what matters.
Well, Dr. Burgi, we really appreciate you taking the time out of your weekend to
There's a lot going on
speak
right
to
now.
a couple of PT students. We really appreciate you taking that time. I know you got a lot going on right now with the new job. Yeah, I'm sure there's a lot going on for you right now. So thank
Yeah,
you
of
so
course.
much.
And if anybody
for
like
taking the time
listening has questions or
speak
wants
with
to reach
us. I know
out,
it's
they can just
been
like
in
send
your
me a
ear
message
for
on LinkedIn,
30,
and I'm
45
happy to
minutes.
connect with whomever. So yeah.
Absolutely. Thank you so much.
Yeah, thank you again.
That's going to be it for this episode of the Unleashed Performance Therapy Podcast. If you have anything you want us to talk about on the podcast, shoot us a DM on Instagram at unleashed.tx. And y'all, be sweet to me. Scroll down to the bottom. Give me a 5-star review. Share the podcast with your family and friends. And until next time, peace.